High blood pressure is a common condition these days for all kinds of reasons, not least stress. But if you've been diagnosed with it, don't assume medication is the only answer. And if you haven't, we'll be talking about some choices that could help you avoid it. So high blood pressure, also known as hypertension, is when the pressure in your blood vessels is high. Now generally there are no clear symptoms to speak of, but if it isn't treated, it can be serious. The one tried and tested way to find out if you do have it is to get your blood pressure checked. If you've been diagnosed with high blood pressure, you might be worried about taking medication to bring the blood pressure down. As always, lifestyle plays a crucial part in treating this condition, and if you can get your blood pressure under control through the following, you might avoid delay or reduce the need for medication. Blood pressure can go up as your weight goes up. Being overweight can also cause disrupted breathing while you sleep, also known as sleep apnea, which can send your blood pressure even higher. Losing weight is easily one of the more beneficial changes you can make. Losing even a small amount of weight can help reduce your blood pressure. Getting active about half an hour, 4 days a week can help lower your blood pressure too. The thing about exercise is it can stop you from developing hypertension, and if you already have it, exercise can help bring down your blood pressure way down. Remember though, consistency is crucial. If you stop exercising, the blood pressure can start to creep up again. So it doesn't have to be running. It could be walking, cycling, swimming, or why not dancing? Strength training is also of benefit, but as with anything exercise related, talk to your doctor first about what's going to be best for you. With exercise comes diet, and this is where you can really make a big difference in lowering your blood pressure. Whole grains, fruits, veg, low-fat dairy products, these are what your diet should be full of. Avoid saturated fat and cholesterol too. It isn't easy to change your eating habits, but you can help your mission by keeping a food diary. Noting what you eat, even if it's for a few days, can give you a surprising insight into your eating habit. Watch what you eat, how much and when. Boost your potassium. It can lower the effects of sodium on your blood pressure. You can get your share from fruit and veg rather than supplements. Your ideal potassium intake that's best for you can be determined by talking to your doctor. Also, read food labels when you're shopping and try to stick to the plan if you're out to dinner too. So food labels are there for your information. A small reduction in your intake of sodium can also improve heart health and reduce blood pressure. You can do this by going with low sodium versions of food and drink that you normally go with. Eat less processed food, which typically contains more than its fair share of sodium. And whatever you do, don't pass the salt. Now, without wanting to ruin anyone's fun, the holy trinity of lowering your blood pressure comes in 3 steps, which you may not like, but lower the amount of alcohol you drink. Alcohol can be good for you in moderation and not so in excess. 1 drink a day for a woman and 2 a day for men is generally the right amount to lower blood pressure, but overdoing it ruins the good that the specific amount provides you with, elevates blood pressure, and can actually diminish the effectiveness of blood pressure medications. With drinking comes smoking. We know that each cigarette increases your blood pressure for a while, but after you finish smoking and stopping smoking brings your blood pressure levels back to normal levels. Of course, there are other benefits to not smoking, which you don't need me to remind you of. Smoking and caffeine are also linked in the pleasure stakes. Now, the role caffeine plays in blood pressure research is still debated. We know it can raise blood pressure significantly in people who rarely consume it, but people who drink coffee regularly may experience little or no effect on their blood pressure. Chronic stress may add to high blood pressure, and if you react to stress by eating unhealthy food, drinking alcohol, or smoking, you can get into a bit of a loop. So take some time to think about what causes you to feel stress, such as work, finance, family, then consider how you can eliminate or reduce stress. If you can't eliminate all of your stresses, you can at least cope with them in a healthier way. You can check out my video about how to do this. Keeping tabs on your blood pressure at home is always a good idea. You can get blood pressure monitors available at most chemists or online. And as always, talking with your doctor about changes or lifestyle changes you're making to help your blood pressure is always a good idea. That's it for now, guys. Hope this has been of help, and remember, don't forget to share, like and subscribe.